Hi guys, how are you doing? It's Elaine Bintz, certified health coach and personal trainer, and we're on day 16 of our 30-day health challenge. So we're more than halfway to the end of our challenge. I hope everybody is having a great weekend, and I hope your new year is getting started off on a great start. Today's topic is strength ratios. So today's topic is actually going to be in a series of 6 videos. This is the first of 5 more videos. So a strength ratio, what is that? A strength ratio is amount of strength a joint. Each joint has movements that are the prime mover, the agonist, and then the antagonist, which is the opposite movement. So I'm going to break the body down into 6 different videos. So today's joint is going to be shoulder, and then we're going to do other joints such as the elbow joint, the lumbar spine, the hip, the knee, and the ankle. So today's shoulder, we're actually going to go over 4 different movements. And I just want to throw this out as a caution. If you are experiencing any sort of an injury or you're currently in rehab or physical therapy, please always check with your doctor or your physical therapist before you try doing some of the movements that we're doing together. So I'm a bachelor level educated professional. I am a certified personal trainer through the American Council on Exercise, and I am using their research on strength ratios in order to explain how you can apply this information into your own life, into your own strength training, and also hopefully to give you a little bit of information if you do tend to have shoulder discomfort or knee discomfort or hip discomfort or injury, or if you tend to, get a lot of ankle injuries or you have tendonitis or something going on at the elbow. So hopefully using some of this information and applying it to your own life, it'll make things make a little more sense in your life. So let's talk about the shoulder. So there's actually more than these 4 movements that occur at the shoulder joint. We're just going to go over 4 of the movements today. We're not going to go over abduction and adduction. We're going to talk today about flexion, extension, internal and external rotation. So first off, what are those movements? So 2 movements that are opposing movements that you should be able to do at the shoulder are flexion, which is bringing the shoulder into a flexed position, and then extension, which is moving the arms back away from anatomical position. So what is the strength ratio? So if you have a calculator handy, you could do the math with us. The appropriate, what should be your strength ratio for shoulder flexion and shoulder extension is the muscles that we're primarily using. The shoulder flexion would be anterior delts, the front of the shoulder, and then extension, those would be your posterior delts or the back of the shoulder, and then you're also using your trapezius muscles when you go in the back. So for example, if we were going to do like a dumbbell raise, the motion that is flexion would be the dumbbell raise, and the motion that is extension would be bringing the dumbbell behind us. So a lot of people will go on a bench, like an incline bench, and they'll do a motion like this, and that demonstrates shoulder extension. So what is the appropriate number? What should you be able to lift for flexion and extension? So you should be able to lift a 2 to 3 ratio. So what does that mean? So let's do the math real quick. So if you just divide the number 2 and then you divide that by 3, for flexion, you should be 2/3 as strong as you are for extension. Or you can do the numbers a little bit differently. You could divide the 3 by the 2 and you get 1.5. So you should be 1.5 times as strong in shoulder extension as you are in flexion. So let's put those into real numbers. So if you could dumbbell raise 10 pounds, so 10 being the 2 in this strength ratio, then you should be able to extend 15 pounds extension in the 2 to 3 ratio. So if you divide the 15 by the 10, this would be the 3 and the 10 pound would be the 2. So 3 to 2. So you could apply this in your life if you're having a job where you're sitting like this a lot. Maybe you're at a computer or you're using a phone and you're texting and you're doing a lot of this motion. You might actually need to stretch the front of your shoulders and your chest, and you might not be as strong in extension if you don't do that movement in everyday living. So the other two motions we're going to go through are internal and external rotation. So first off, what are those movements? So internal rotation is rotating your shoulder inward, and then external rotation is moving outward. So if you can imagine playing sports, if you're doing something like a push-up and you're pushing up, that requires internal rotation. Let's say, for example, you're playing tennis and you're doing a backhand, that requires external rotation or motion away from the body. Now keep in mind, every physical activity, anytime you're doing movement, especially in the shoulder, you can't just isolate one motion. Your muscles are going to use different components. Even in the backhand, you have to internally rotate and then exhale, backhand, and externally rotate at the shoulder joint. So you can't just isolate and do one movement usually. So what should this strength ratio be? So internal rotation, most people that I've come across in my 21 years of practice are stronger in internal rotation, and actually they should be. Using the subscapularis, which is one of those 4 rotator cuff muscles. So if you think about like shoulder rotation, there are these 4 muscles that are at both of your shoulders, and oftentimes people will talk about them and just use the everyday term, which is rotator cuff muscles. And a lot of times I'll find that my clients are injured, or they have had some sort of procedure in the past or had physical therapy, and what I have found in my own practice, an overwhelming amount of people are not strong in external rotation. So I take my clients through a lot of opening exercises, especially if they are prone to shoulder injuries. I try to make sure that we have the appropriate strength ratio for internal and external rotation. So what is that? Internal rotation is 3 to 2 external rotation. So if we use the same amount of weight, if you have your 15-pound dumbbell, you should be able to internally rotate 15 pounds, and you should be able to externally rotate 10 pounds. So the 15 divided by the 10, in this case now, this one is the 3, and then this one is the 2. With flexion, this was 2 to 3. So the numbers, when you're talking about ratios, this is not intended to confuse you. And if you are working with a trainer or a coach, you can definitely talk to them about this and say, hey, can we do an assessment and just see where I'm at with my numbers? Because if you are getting any sort of chronic shoulder discomfort or injury, I know that is not fun. I've experienced that in my own history of playing sports. You know, icing and resting and stretching, they can only do so much if you are inappropriately strengthening the muscles. So please apply this information in your own life. Thank you again for your time. I really appreciate you listening. Tomorrow we're going to go over a different joint for a strength ratio. Again, my name is Elaine Bintz, health coach, personal trainer, and I look forward to seeing you tomorrow. Have a great day. Bye.